You've probably eaten these fruits dozens of times without a second thought. But secretly dangerous? What if I told you it could silently raise your risk of stroke? Especially if you're over 50. As a neurologist, even I was surprised by the latest research. In the next few minutes, I'll reveal what it is, why it's risky, and how to protect your brain without giving up the foods you love. Hello and welcome to Daily Perfect Health, your trusted source for senior wellness and brain-healthy living. I'm Dr. Laura, and today we're diving into something surprising. Some of your favorite fruits might not be as heart or brain-friendly as you think, especially as we age. Grapefruit. You've probably been told grapefruit is a great choice for heart health. Low in calories, packed with vitamin C, and refreshing on a summer morning. It sounds like the perfect fruit. But what if I told you that for millions of older adults, especially those over the age of 50, eating grapefruit regularly could be quietly setting the stage for a serious medical event like a stroke? Let me explain. The issue isn't that grapefruit is bad in the way we think of processed junk food. The danger is hidden, and it lies in how grapefruit interacts with your body, especially when combined with medications. You see, grapefruit contains natural compounds called furanocoumarins. These chemicals block an important enzyme in the liver known as CYP3A4. This enzyme plays a vital role in how your body metabolizes or breaks down many common prescription drugs. Now here's where it becomes concerning. When CYP3A4 is inhibited, the medications you take may not be properly processed. Instead of being broken down and excreted from your body, they stay in your bloodstream at much higher levels than intended. That might not sound alarming at first, but over time, this can lead to serious, even life-threatening complications. We're talking about increased risk of internal bleeding, dangerously low blood pressure, irregular heart rhythms, and yes, stroke. Many of the medications impacted by grapefruit are ones seniors commonly take: statins for cholesterol, blood pressure medications like calcium channel blockers, anti-anxiety drugs, and even some blood thinners. So you can imagine, if someone is on 2 or more of these medications and has a daily grapefruit or even half a glass of grapefruit juice, their risk profile starts to shift in a direction that's neither obvious nor safe. I want to paint a picture for you. Imagine someone like Margaret, age 72, living independently and taking good care of herself. She's on a statin and a calcium channel blocker, fairly standard medications. Every morning, she starts her day with a grapefruit and a handful of pills, thinking she's doing something healthy. Over weeks or months, she begins to feel lightheaded. She attributes it to getting older. Then one day, she stands up quickly, gets dizzy, loses her balance, and hits her head. In the emergency room, her medication levels are found to be abnormally high. What triggered it? The grapefruit, blocking her liver's ability to clear the drugs from her system, slowly elevating the dosage in her blood without her even knowing. And that's just one scenario. Others may not even have noticeable warning signs before a complication strikes. That's what makes this issue so dangerous. It's silent. It doesn't scream. It whispers, until it doesn't. Now, does this mean that everyone should fear grapefruit? Not necessarily. But if you're over 50 and taking prescription medication, which many are, you must check with your doctor or pharmacist. Many drugs come with a warning label. Avoid grapefruit while taking this medication. Those labels are there for a reason, and unfortunately, they often get ignored or misunderstood. So what can you do instead? There are plenty of safer fruit alternatives that won't interact with your medications. Oranges, blueberries, apples, pears, and kiwis are all generally safe and still provide a nutritional boost without compromising your medication safety. It's not about eliminating fruits, it's about choosing wisely based on your health needs. There's something else I want to stress. Stroke is one of the leading causes of disability and death in older adults, but it's also one of the most preventable. Making informed choices about what you eat and how it interacts with your medications can dramatically reduce your risk. You don't need to overhaul your entire lifestyle overnight. Sometimes it's as simple as swapping out a fruit. Something as small as that can make a real difference. If you're watching this and thinking, I eat grapefruit every day, what should I do? The first step is to review your medications. Check the labels. Then talk to your healthcare provider. Don't stop your medications or make changes on your own. Just open the conversation. That's how proactive health decisions begin. And here's the thing. Grapefruit isn't the only fruit with potential downsides. There are others that might surprise you. In the next part of this series, we're going to explore another popular fruit, often labeled as a potassium powerhouse, and why it may not be so harmless after all. Your health deserves clarity, not confusion. I want you to have the facts, so you can live with confidence and energy at every stage of life. Stay informed, stay safe, and let's keep going, because this is just the beginning. Banana. You've probably never thought twice about a banana. It's the go-to fruit for millions. Easy to grab, simple to digest, and full of nutrients. But what if I told you that this so-called perfect snack might not be so perfect for everyone, especially if you're over 60? Here's where it gets interesting. Bananas are loaded with potassium. And yes, potassium is essential. It helps your nerves work properly, keeps your heart beating regularly, and helps control blood pressure. But in older adults, especially those with any decline in kidney function, and many don't even know they have it, too much potassium can become a serious risk. When the kidneys can't clear out excess potassium efficiently, it builds up in the bloodstream. This can cause irregular heart rhythms, muscle weakness, numbness, and in more severe cases, increase the risk of stroke or sudden cardiac events. And the tricky part? Many medications that seniors are commonly prescribed, like ACE inhibitors or potassium-sparing diuretics, already raise potassium levels on their own. So let's say you're taking one of those medications, and you start your day with a banana every morning, sometimes even two, thinking it's a healthy choice. Over time, your potassium levels could quietly climb without any obvious warning signs until something goes wrong. I've seen patients who thought they were doing everything right, only to learn that their favorite fruit was creating a hidden imbalance in their system. They'd feel lightheaded, unusually tired, or get odd muscle cramps, often dismissed as just getting older. But when we tested their labs, potassium was the culprit. Now add in another layer, the sugar content. A medium banana has about 14 grams of natural sugar and nearly 30 grams of carbs. That may not seem like much, but for seniors managing insulin resistance or type 2 diabetes, those daily spikes in blood sugar can quietly damage blood vessels over time, increasing stroke risk through a different route. So what can you do? You don't have to swear off bananas forever, but it's smart to become more selective. If you take medications that impact potassium, or you've had even mild kidney issues, consider having bananas only occasionally, not daily. Go for smaller bananas, balance them with fiber-rich fruits like berries or apples, and check in with your doctor about potassium levels if you're feeling off. A simple blood test can give you clarity. Food isn't the enemy, but for seniors, health isn't just about what's generally good, it's about what's good for you, given your age, your medications, and your body's current needs. And here's the part that most people overlook. Banana is just one of several healthy fruits that can turn harmful with age. Because in the next segment, we're digging into a fruit that's often marketed as a heart helper, rich in antioxidants, great for snacking, but if you're on common blood thinners, even a small serving could put your health at serious risk. Most people eat this fruit, thinking it's doing their brain and heart a favor. But the truth is, for many seniors, it could be a dangerous mix. I'll explain everything, and trust me, you'll never look at this fruit the same way again. Let's keep going. The next one might surprise you even more. Small, sweet, and deadly. They look innocent in your bowl, but cherries might be quietly increasing your risk of stroke, especially if you're over 60. Behind that tart flavor lies a dangerous cocktail of compounds that could be messing with your medications and your heart. Could your favorite snack be turning against you? Let's start with what makes cherries seem so beneficial. They're high in anthocyanins, the antioxidants that give them that deep red color. These compounds have been shown to fight oxidative stress and reduce inflammation, two important factors when it comes to brain aging and heart health. In moderation, these are absolutely good things. But here's where it gets complicated. Cherries, especially the sweet variety like Bing or Rainier, are also high in natural sugars. A single cup can contain over 17 grams of sugar, and most people don't stop at 1 cup. Now for a younger adult with good metabolic health, that's not always a big deal. But for older adults, particularly those with insulin resistance or type 2 diabetes, and that's over 33% of seniors in the US, that sugar can become a silent threat. Consistently high blood sugar levels damage blood vessels over time, including those in the brain. This contributes to microvascular damage, which increases the risk of cognitive decline and ischemic stroke. And it doesn't happen overnight. It creeps in slowly, often without symptoms, until something serious occurs. There's also a lesser-known issue. Cherries are a natural source of salicylates. These are plant-based chemicals that mimic some effects of aspirin. They thin the blood slightly. For most people, that's not a major concern. But if you're already on blood thinners like warfarin, clopidogrel, or even daily low-dose aspirin, adding cherries regularly to your diet could amplify the anticoagulant effect. That means a greater risk of bleeding, including hemorrhagic stroke, the kind that results from a burst blood vessel in the brain. In 2019, a study published in Neurology explored the increased risk of brain bleeds in elderly patients who had elevated salicylate intake alongside blood thinners. While it didn't single out cherries specifically, foods high in natural salicylates were part of the dietary factors examined. The takeaway? For older adults, even healthy foods can interact with medications in unexpected ways. Now let me tell you about a patient. We'll call her Martha. She was 68, in relatively good health, managing her blood pressure and cholesterol, and she just started on a daily aspirin routine, as recommended by her previous doctor. Wanting to support her health, she began eating fresh cherries every evening after dinner. Within weeks, she noticed some light bruising on her arms and legs, then experienced a dizzy spell that sent her to the emergency room. Her blood work showed that her clotting factors were off. Her blood was too thin. Fortunately, she was treated in time, but the combination of aspirin and daily cherry consumption turned out to be a more potent mix than she realized. Another concern is that many seniors don't always opt for fresh cherries. Dried cherries, cherry juice, or even cherry concentrate are increasingly popular, especially those marketed for joint pain or better sleep. The problem? These forms are highly concentrated. A small serving of dried cherries can have double the sugar of fresh, and juices are even worse. This spikes insulin, loads the bloodstream with glucose, and over time contributes to the very vascular damage we try to avoid in older age. Now, I'm not saying never touch cherries again, but moderation is key, and awareness is everything. If you enjoy cherries, opt for fresh, dark varieties in small portions, no more than half a cup a few times a week. Avoid dried or juiced versions, unless your doctor has cleared it, especially if you're taking any blood-thinning medications. Also, timing matters. Don't combine cherries with medications that impact clotting or blood pressure without understanding the interactions. And if you're already at high risk for stroke, whether due to family history, past events, or existing vascular issues, this is one fruit to monitor, not mindlessly enjoy. And the truth is, cherries aren't the only ones. There's another fruit that's even more loved in senior circles, especially during summer. It's light, refreshing, full of water, and promoted as a weight loss helper. But what most people don't realize is that it contains a compound that may dilate blood vessels too much in those with pre-existing blood pressure problems. Especially when paired with certain medications or eaten in excess, it could tip the scales in the wrong direction. This fruit is often given to seniors in care homes, served at picnics, and even recommended by dietitians. But new evidence suggests it might not be as innocent as we once thought. If you care about your brain health and want to avoid unexpected risks, you're going to want to hear about this one next. Let's keep going. The next fruit might be even more surprising than cherries. They call it the king of fruits, but for seniors, it might just be a silent assassin. Sweet, juicy, and seemingly harmless, mangoes could be pushing your blood sugar to dangerous levels and setting the stage for a sudden stroke. Could your favorite summer fruit be your biggest health threat? Here's the truth. Mango has one of the highest natural sugar contents of any fruit. A single medium mango contains nearly 45 grams of sugar. That's equivalent to about 11 teaspoons. And while it's natural sugar, your bloodstream doesn't really care whether it came from fruit or a soda can. Sugar is sugar, and when it floods your body too quickly, it can create sudden spikes in your blood glucose levels. Now, what does that mean for stroke risk? In seniors, glucose spikes, especially frequent ones, contribute directly to something we call endothelial dysfunction. That's when the inner lining of your blood vessels stops working properly. Instead of staying flexible and responsive, your arteries begin to harden and narrow. And when this process starts in the small blood vessels of the brain, it increases the chance of ischemic stroke, where a clot blocks blood flow to part of the brain. Let me give you a case that brings this to life. I had a patient, 67 years old, reasonably active, taking medication for mild hypertension. She loved mangoes. Every morning she made herself a tropical smoothie: mango, banana, and orange juice. All fruits, all natural, but also all high in sugar. She wasn't diabetic, but after a routine blood test showed elevated fasting glucose and HbA1c in the pre-diabetic range, we dug a little deeper. Her continuous glucose monitor revealed that her morning smoothie, which she assumed was helping her health, was causing spikes up to 190 mg/. That pattern, over months or years, could silently damage her arteries. This isn't just anecdotal. A 2015 study in neurology found that glucose variability, meaning the big ups and downs in your blood sugar, is a stronger predictor of stroke than fasting glucose alone. And those spikes, they often come from healthy habits, like fruit overload. But sugar isn't the only problem. Mango contains compounds called urushiol, also found in poison ivy. While the levels are low, they can still cause inflammatory responses in some individuals, especially in older adults with sensitive immune systems. That inflammation doesn't always show up as a rash. Sometimes it's internal, and chronic inflammation is a known contributor to vascular aging and clot formation. Another little-known fact, mango may interfere with how your liver metabolizes certain medications. It can inhibit cytochrome P450 enzymes, particularly CYP3A4, which are responsible for breaking down many commonly prescribed drugs for seniors, including statins, calcium channel blockers, and even some blood thinners. That means, if you're consuming mango frequently, while on these medications, your drug levels could build up unpredictably. The effects could be anything from dizziness and fatigue, to an increased risk of internal bleeding or blood pressure swings, both dangerous when we're talking about stroke prevention. And it's not just fresh mango. Dried mango, mango juice, tropical fruit blends, they're all concentrated sources of sugar, often consumed in higher volumes. A single cup of mango juice may contain 50-60 grams of sugar, with little to no fiber, meaning the glucose hits your bloodstream even faster. With aging digestive systems that are less efficient at modulating sugar release, this can lead to insulin surges that tax the pancreas and eventually harm vascular integrity. So what's the takeaway? Should seniors avoid mango entirely? Not necessarily, but portion control is critical. Half a mango, eaten with a source of fat or protein, like a few almonds, will slow sugar absorption and reduce the vascular strain. Avoid drinking mango as juice. And if you're on medications, especially for heart or blood pressure issues, it's worth having a pharmacist check for possible interactions. The goal is not to fear fruit, but to understand it in the context of your body's changing needs as you age. It's about making smart adjustments, not total elimination. You can enjoy mango, but it needs to be a treat, not a staple, especially if you're managing blood pressure, blood sugar, or taking medications that affect circulation or clotting. And just when you think you've got your fruit intake figured out, wait until we talk about the next one. This one's often praised for helping digestion, and is even recommended for hydration. Yet in seniors it can sneakily drain your electrolyte balance, trigger heart rhythm problems, and even increase the risk of fainting or falls, all of which are stroke-related red flags. It's sitting in most kitchens right now, and the risk it carries for older adults may be even more surprising. Dry fruits. You've been told they're a superfood, perfect for aging gracefully. But what if I told you that a handful of dry fruits could be quietly sabotaging your brain and heart health? From hidden sugars to dangerous mineral overloads, these innocent-looking snacks could be increasing your stroke risk overnight, especially if you're over 60. The problem lies in the concentration. When you remove water from fruit, you're not just shrinking it, you're concentrating the sugars, salts, and calories into a much smaller package. One small handful of raisins, for instance, can carry more than 20 grams of sugar, more than a full-sized candy bar, but it's natural sugar, people say. True, but to your aging blood vessels, sugar is sugar. High levels of sugar spike insulin, increase inflammation, and over time, damage the delicate lining of your arteries. That's not just theory, it's a risk factor for stroke, especially in brains already vulnerable to reduced circulation or plaque buildup. And that's not the only concern. Many commercially packaged dry fruits are treated with sulfites to preserve color and shelf life. While sulfites might be harmless to some, they can trigger inflammation, especially in those with respiratory issues or autoimmune conditions. Dehydrated apricots, for example, often carry more sulfites than any other preserved food. Now imagine that inflammation settling in around your already stiffening arteries or affecting the smooth inner walls of blood vessels where clots tend to form. That's a recipe not for wellness, but for vascular strain. It gets more serious when we talk about potassium and sodium. Seniors often walk a fine line when it comes to electrolyte balance. Dried fruits like prunes and dates are very high in potassium. In individuals with kidney issues, diagnosed or undiagnosed, that excess potassium doesn't get filtered out efficiently. It accumulates, which can interfere with heart rhythm and contribute to vascular irregularities, sometimes leading to clot formation or blood pressure surges that raise stroke risk dramatically. Let me tell you about a patient I consulted not long ago. A 74-year-old woman, managing her diabetes well for years, decided to swap cookies for a healthier option, dried fruits and mixed nuts. Her fasting sugars started climbing. She couldn't figure out why. After all, she hadn't changed her medication, her walking schedule, or her routine. But she had started snacking more, thinking it was a safe alternative. What she didn't realize was that those tiny dried figs and apricots were delivering a sugar bomb to her system. Over time, her blood became more viscous, and her HbA1c rose. One morning, she experienced numbness on one side of her face. It was a TIA, a transient ischemic attack, also known as a mini stroke. Thankfully, it passed without permanent damage. But it was a wake-up call. When she cut back on dried fruits and stabilized her sugar, the risk reduced. But not without a scary moment first. Now, this doesn't mean all dry fruits are the enemy, but we must use precision. Think of dry fruits as concentrated medicine, helpful in the right dose, harmful in excess. For seniors, moderation is no longer optional, it's critical. A couple of soaked almonds in the morning, great, but handfuls of sweetened cranberries throughout the day, that's too much for an aging metabolism. And don't be fooled by labels that say no added sugar. The natural sugars are already high enough to cause damage in certain cases. If you're on blood thinners, be cautious. Some dried fruits like cranberries can enhance the effect of these medications, increasing bleeding risk. Others, like raisins, can cause blood pressure fluctuations due to their natural sugar and iron content, which can be destabilizing in people already taking heart or hypertension meds. And when you add in the high calorie density, it's easy for even small portions to contribute to weight gain, another risk factor for stroke. So what's the takeaway here? If you or a loved one are over the age of 60 and eat dry fruits regularly, it's time to pause and evaluate. Limit the intake to just a few pieces a day, ideally soaked to improve digestibility. Avoid packaged or sugar-coated varieties, and always read the label. Look for sulfite-free and unsweetened options. Most importantly, discuss your daily diet with your healthcare provider or dietitian. Small adjustments in something as innocent as a snack can have big consequences when it comes to brain and heart health. And here's something that might surprise you even more. While dry fruits are often thought of as heart healthy, some newer studies suggest that for seniors the risk-to-benefit ratio shifts. A 2020 study from the Journal of Nutrition and Aging found that excessive consumption of dried fruits among elderly patients was associated with higher markers of arterial stiffness, a key indicator of stroke and heart attack risk. Another study in Clinical Interventions in Aging raised concerns about sugar-dense fruits increasing oxidative stress in aging tissues, particularly the brain. Now, if this surprised you, just wait until you hear about the next fruit. It's one that most of us associate with hydration, cooling, and refreshment, especially in summer. It's colorful, juicy, and found in every health-conscious household. But inside its watery sweetness lies a very different story, one that might just change the way you think about what's really good for you. It's the summer favorite everyone trusts. But could this hydrating, innocent-looking fruit be silently spiking your stroke risk? New research shows that for seniors, watermelon's sky-high glycemic load and hidden potassium overload could be more dangerous than refreshing. What you thought was keeping you cool may be quietly pushing your blood vessels to the edge. Now, don't get me wrong, watermelon in small amounts has its benefits. It's over 90% water, loaded with vitamin C, and it even contains lycopene, an antioxidant known for its heart protective properties. So how could something that seems so light and hydrating be dangerous, especially for older adults? Let's start with something many people miss, the sugar load. One medium slice of watermelon contains about 17 grams of sugar, and since it tastes light, people often eat several slices at a time, especially in hot weather. But here's the problem. Because watermelon has very little fiber, that sugar enters your bloodstream fast. It's called a high glycemic index food. That means it spikes blood sugar rapidly, much like candy or soda. For seniors, particularly those with insulin resistance, prediabetes, or full-blown diabetes, those sudden sugar spikes can cause damage to the inner lining of arteries. Over time, this damage contributes to the formation of plaques and clots, the very things that trigger strokes. And this gets more concerning when you think about how the body of a 70-year-old handles sugar compared to a 30-year-old. Insulin sensitivity naturally decreases with age. This means that even moderate amounts of sugar can cause more harm than they did decades ago. For someone with already narrowing arteries or a history of high blood pressure, watermelon isn't just harmless, it can quietly be contributing to vascular instability. Now consider this, seniors often reach for watermelon during the hottest days of summer. That seems like a good idea, right? It's hydrating, but if you're also on blood pressure medication or diuretics, watermelon can become a risk multiplier. Here's why: watermelon is high in potassium, and potassium is good in normal amounts. But combine it with medications that also retain or alter potassium levels, and suddenly you may be facing hyperkalemia, a condition where too much potassium causes heart rhythm issues. These irregular rhythms can be precursors to stroke and cardiac arrest, especially in those with existing cardiovascular conditions. Let me share a story that hits this point home. An 80-year-old man, living independently and in relatively good health, had always been proud of his dietary habits. Every summer, he made it a routine to eat a large bowl of watermelon every afternoon to stay hydrated. One day, after a particularly hot afternoon, he felt dizzy and faint. His caregiver took him to the ER. His electrolytes were completely out of balance, potassium was dangerously high, blood pressure had dropped, and a mild arrhythmia was detected. While he recovered without a major event, the cardiologist later told him that continued overconsumption of potassium-rich foods like watermelon, especially during dehydration and with his medications, could have led to a stroke or worse. Watermelon also contains a compound called citrulline, which can lower blood pressure by relaxing blood vessels. That sounds like a good thing, until it's not. For seniors already on antihypertensives or blood thinners, this combination can cause their blood pressure to dip too low, increasing the risk of fainting, falls, and restricted blood flow to the brain. Reduced cerebral circulation, even for a short period, can trigger a transient ischemic attack, often called a mini-stroke. There's also the insulin angle. In a 2022 study published in the journal Nutrients, researchers examined how high glycemic fruits like watermelon affect older adults. They found that while moderate intake was not harmful, large portions were linked with elevated blood sugar variability, increased inflammation markers, and endothelial dysfunction, all conditions that heighten stroke risk. Similarly, a 2019 review in the Journal of Geriatric Cardiology raised red flags about high-sugar fruits, leading to metabolic stress in seniors who appeared healthy but had hidden insulin resistance. So what's the smarter way to consume watermelon if you're over 60? It comes down to portion control and awareness. A few small cubes, not slices, as part of a meal, not a standalone snack. Eat it with a little protein or fat to slow down sugar absorption. And most importantly, avoid consuming it in large quantities when you're already taking medications that impact blood pressure or potassium levels. Watermelon isn't inherently dangerous, but in aging bodies with slowed metabolism, medication interactions, and underlying vascular wear and tear, even the seemingly innocent can become harmful. Seniors need to be more strategic with their food choices, because the foods that worked well in your 40s may now behave differently in your 70s. Now we've talked about mangoes, we've peeled back the truth behind dried fruits. And now watermelon, often seen as the most harmless, isn't so harmless after all. But wait until you hear about what's coming next. There's another fruit that's promoted as a metabolism booster, a detoxifier, and even a morning miracle in trendy wellness circles. Yet inside that glow is a powerful chemical that could dangerously interfere with some of the most common medications seniors take every day, and the results might be far more serious than you'd ever expect. It's sweet, tangy, and a symbol of health. But what if I told you that pineapple, the golden tropical delight, could be a hidden threat to your brain? For seniors, this fruit's secret acidity, enzyme content, and sugar profile might be doing more harm than good, quietly increasing the risk of stroke and vascular damage with every juicy bite. It may look like sunshine on the outside, but inside it's a storm waiting to happen. Because under the sunshine-sweet surface of pineapple is a hidden danger, one that can quietly disturb your body's delicate balance, and over time or even overnight, increase your risk of a serious vascular event like a stroke. Pineapple is extremely acidic. On the surface, that doesn't sound alarming. But the truth is, in older adults, especially those with existing gastric or vascular sensitivity, its sharp acidity can contribute to a cascade of health issues. It can lead to irritation of the esophagus, worsen GERD symptoms, and disrupt gut-brain communication, which is increasingly being studied as a factor in stroke risk. But more importantly, pineapple has a very high glycemic index, meaning it can rapidly spike your blood sugar. In fact, when it's fully ripe or served canned in syrup, it shoots sugar into your bloodstream faster than you might expect. For seniors, especially those who are pre-diabetic or diabetic, This kind of sugar surge can lead to inflammation of blood vessels, oxidative stress, and poor vascular elasticity, all of which are risk enhancers for stroke. Now consider this: many older adults are encouraged to eat pineapple for its bromelain content, but bromelain, while helpful in small controlled doses, is a blood thinner. When combined with prescription anticoagulants like warfarin, clopidogrel, or aspirin, common in seniors with cardiovascular concerns, it can create a dangerous situation. The blood can become too thin. That increases the chance of internal bleeding and hemorrhagic stroke. Let me share a real-life example. A 68-year-old man, recently placed on a blood-thinning regimen after a minor heart attack, decided to start juicing fresh pineapple each morning after reading that it fights inflammation. Within 2 weeks, he noticed excessive bruising on his arms and legs. He also felt dizzy when standing up and complained of headaches. One morning, he collapsed. In the ER, scans revealed a minor intracranial bleed, likely caused by excessive thinning of the blood. Doctors connected the dots. The bromelain from pineapple, on top of his prescribed anticoagulant, had pushed his clotting levels dangerously low. And this isn't rare. A study published in the journal Drugs and Aging highlighted how the interaction between natural supplements or foods like pineapple and prescribed medications is often overlooked, especially in senior populations. Another 2021 study from Nutrients reported that the overconsumption of high GI fruits like pineapple can lead to postprandial hyperglycemia, those intense sugar spikes after eating, which are directly associated with increased arterial stiffness, especially in older adults. Stiff arteries mean higher blood pressure and higher stroke risk. Now, this doesn't mean pineapple is poisonous. It's not. But the dose and the context matter. For a younger, active person without any underlying medical conditions, a few slices may be harmless or even beneficial. But for someone on blood thinners, managing glucose levels, or trying to control inflammation, the situation is different. Older adults often have reduced kidney function, slower digestion, and a narrower margin for nutritional error. Their bodies are more sensitive to blood pressure shifts, sugar surges, and medication interactions. When you mix high-acid, high GI fruits like pineapple into that equation, without careful monitoring, the result can quietly lead to vascular strain, sometimes without symptoms until it's too late. So what should you do? First, don't panic. You don't need to eliminate every fruit from your diet, but you do need to be aware. If you enjoy pineapple occasionally, and you're not on blood thinners, just stick to small portions, preferably in fresh, not canned form. Always eat it with a meal, not alone, so you blunt that sugar spike. And most importantly, if you're on any heart or stroke medications, speak with your doctor or pharmacist before adding pineapple regularly to your diet. Also, read labels on juices, smoothie blends, or fruit salads. Pineapple is often added in hidden amounts for flavor, and it can sneak up on you. This is part of a bigger conversation. The idea that natural doesn't always mean safe, and that certain fruits, even the ones we think of as wholesome, can become dangerous under the right conditions. Pineapple is a good example of how aging changes the way our bodies respond to what we eat. What once felt like a fresh treat might now be working silently against your health goals. So be cautious, be informed, and always think about how each food you eat interacts with the medications and conditions you're managing. Stroke risk isn't just about genetics or bad luck, it's about daily decisions. If you care about your brain health and want to avoid unexpected risks, you're going to want to hear about this one next. Let's keep going. The next fruit might be even more surprising than pineapple. It's soft, vibrant, and praised as a superfruit, but papaya may be silently wreaking havoc on the bodies of older adults. Behind that tropical glow lies a biochemical twist that could increase stroke risk, disrupt heart rhythm, and throw your blood pressure into dangerous territory. Sounds shocking? It shocked me too, until I saw the data. This isn't about fear, it's about knowing what's really inside the fruit you thought was helping you. Because for older adults, especially those with heart, liver, or vascular conditions, papaya can carry risks. And these risks don't always show up with warning signs. Sometimes they accumulate in the background, slowly increasing the chance of a serious event like a stroke. One of the biggest issues is papaya's potassium load. While potassium is essential for healthy muscle and nerve function, too much potassium, especially in seniors with declining kidney function, can become dangerous. Hyperkalemia, or excess potassium in the blood, is a known risk factor for cardiac arrhythmias and sudden drops in blood pressure. In certain cases, it can even lead to strokes triggered by irregular heartbeats or poor cerebral blood flow. Now consider this: a single medium papaya contains over 780 milligrams of potassium. For an elderly person with compromised kidney filtering ability, that could be far more than their body can safely handle, especially if they're also consuming bananas, oranges, or using salt substitutes that are potassium-based. It's not the papaya itself, but how it adds up in an aging body, that makes it concerning. Then there's another layer, one most people don't talk about. Papaya contains an enzyme called papain, which is similar in function to bromelain in pineapple. It helps with protein digestion and can reduce inflammation. But in seniors on blood-thinning medications, or those with ulcers, papain can increase bleeding risk or cause gastrointestinal irritation. That's especially true with unripe or semi-ripe papaya, which is often used in salads and juices. Let me share a case I came across. A 73-year-old woman, generally healthy, began eating papaya every morning as part of her natural cleanse routine. She had mild kidney disease, but nothing too severe. Within 2 weeks, she started experiencing irregular heartbeat, muscle weakness, and a feeling of confusion she couldn't quite explain. Blood work revealed dangerously elevated potassium levels, requiring hospitalization. The culprit, her diet, rich in papaya and other potassium-heavy fruits, combined with reduced renal clearance. She thought she was doing everything right. But sometimes when your body changes with age, what was once helpful can become harmful. There's also a growing body of research to support this concern. A 2020 study published in the Clinical Journal of the American Society of Nephrology highlighted how even moderately elevated potassium levels in elderly patients are associated with increased risk of sudden cardiac events, which can escalate into strokes. Another study from Nutrition and Aging discussed how unregulated intake of natural enzymes, like papain, can interfere with medications metabolized in the liver and thin the blood to risky levels. For seniors taking aspirin, clopidogrel, or even supplements like ginkgo biloba, this becomes a dangerous mix. The body's clotting ability is already managed by medication, and then we add a natural enzyme that could push it further. That's where trouble begins. So what should we do? First, papaya doesn't need to be eliminated entirely, but it does need to be respected. Know your kidney function numbers. If you've been told your eGFR is declining, or you're in stage 2 or 3 of chronic kidney disease, talk to your healthcare provider before consuming high potassium fruits regularly. Limit portions to small slices and avoid eating it daily. If you're on blood thinners or have a history of ulcers, skip green papaya completely. It contains higher levels of papain and latex compounds that can worsen GI issues. Also be wary of papaya supplements, digestive enzymes, or herbal blends containing papain. They're often unregulated and concentrated far beyond what's found in the fruit itself. This is a powerful reminder the human body, especially as it ages, becomes more sensitive to imbalances, nutritional, chemical, and even natural. What we call superfoods aren't universally safe. The context of your medication, organ function, and overall health status changes how your body processes each bite. And while papaya may look like a simple tropical treat, in the wrong setting, it can become part of a dangerous equation. Now we've seen how mango, dry fruits, grapefruit, pineapple, and papaya, each celebrated for their health benefits, can turn into silent threats for seniors. But what about the next one? It's a small, sweet, exotic fruit that's loved in summer festivals and family gatherings. It looks innocent, feels hydrating, but inside there's a toxic compound that could trigger inflammation, impair glucose metabolism, and even raise the risk of stroke in ways few people understand. Let's talk about lychee. Sweet, juicy, and innocent-looking, lychee is the fruit many seniors enjoy without ever suspecting danger. But under its delicate skin lies a hidden compound that's been linked to sudden brain dysfunction, blood sugar crashes, and even deadly strokes in vulnerable adults. Sound extreme? Just wait until you hear what the research uncovered, because this tropical treat might not be as harmless as it tastes. Here's something most people don't realize. Lychee contains a naturally occurring toxin called hypoglycin A, particularly in its unripe form. This compound interferes with glucose production in the body, and for children and older adults with low glycogen stores or irregular meal patterns, this can rapidly drop blood sugar to dangerous levels. That's not just fatigue or dizziness. We're talking about acute hypoglycemic encephalopathy, which in some cases has been fatal. Now let's imagine a scenario, one that's more common than you might think. A 68-year-old man, recently retired, starts adding more fruits to his diet. He enjoys lychees every evening, half a bowl after dinner, sometimes more. He's not diabetic, but he's on medications for mild heart disease. One evening, after skipping lunch, he snacks on a handful of lychees to cool down in the heat. Within a couple of hours, he starts feeling weak, disoriented, and faint. By the time he arrives at the ER, his blood sugar is dangerously low, enough to impair brain function. While we often associate low blood sugar with diabetics, seniors with slower metabolism, irregular meals, or those on diuretics or beta blockers can experience unexpected drops too. Add a fruit like lychee, particularly unripe or eaten on an empty stomach, and that becomes a real threat. In fact, this isn't hypothetical. A 2014 study published in the Lancet Global Health explored a series of unexplained neurological outbreaks among children in India. It turned out they'd been consuming lychees on empty stomachs, and many had critically low blood sugar. Some died. While children were the focus, the findings extend logically to vulnerable seniors, especially those with poor appetite, chronic illness, or sensitivity to insulin. Then there's another dimension: lychee's high sugar spike, even in ripe form. For aging individuals with borderline glucose tolerance or prediabetes, this rapid surge in natural sugars, followed by a sudden drop, can stress the body's glucose regulation. When that happens, blood vessels experience inflammatory pressure, especially the delicate ones in the brain. Over time, this kind of stress can raise the risk for mini strokes or full-blown cerebrovascular accidents. Combine that with the fact that some seniors use lychee-based juices or canned lychee syrups loaded with added sugars, and now you're not just stressing glucose control, but heart rate, blood pressure, and possibly even lipid profiles. And it happens quietly, without many noticing, because we tend to label fruits as universally healthy. Now, I'm not saying lychee is poison. In moderation, for healthy individuals with a solid meal schedule and stable sugar levels, it can be enjoyed occasionally. But for senior citizens, there are some important precautions. First, never consume lychee on an empty stomach. Always pair it with a balanced meal, ideally one that contains protein and fiber to slow the sugar absorption. Second, avoid lychee during episodes of illness, fatigue, or periods where you're not eating well. That's when your glycogen reserves are already low, and lychee's effects can become unexpectedly intense. Third, skip the canned or processed versions. Those often contain added sugars and preservatives that increase the metabolic strain on your body. And finally, be aware of portion sizes. A few lychees, 3 to 4 ripe ones, eaten with food is very different than 10 to 15 at once. Seniors with existing insulin resistance, liver issues, or fatigue disorders should speak with their healthcare provider before making lychee a regular snack. A fruit can be hydrating, sweet, and enjoyable, but that doesn't mean it's harmless. Especially not when your metabolism slows with age and your tolerance for sugar or toxins changes. The same fruit that energized you in youth might deplete you in older age. It's all about context. And lychee, despite its innocent appearance, has enough biochemistry behind it to merit caution, particularly if you're managing medications, cardiovascular concerns, or fluctuating energy levels. Now we've talked about the hidden dangers of mango, dry fruits, grapefruit, pineapple, papaya, and now lychee. But the next one is perhaps even more surprising. It's often marketed as a superfruit. It's packed with antioxidants and praised for improving blood flow, lowering blood pressure, and even enhancing memory. Seniors love it in juice form, in smoothies, or even as supplements. But this fruit, despite its many benefits, has one quality that in certain seniors could make it a hidden contributor to stroke risk and blood clotting issues. Let's talk about pomegranate. Pomegranate, it looks like nature's ruby and tastes like a miracle. But hidden beneath those shimmering seeds lies a chemical twist that could interfere with your heart meds, raise your blood pressure, and even increase your stroke risk overnight. Seniors, this isn't a myth. This is the silent side of pomegranate. No one warned you about until now. What most people don't realize is that pomegranate has potent bioactive compounds that don't always interact well with an aging body, especially one on multiple medications. In fact, its so-called miracle properties are what can make it potentially dangerous for certain individuals over 60. Let's talk specifics. Pomegranate contains strong natural compounds known as polyphenols particularly punicalagins and L-glutathione. These compounds are excellent antioxidants. They help fight oxidative stress and reduce arterial stiffness. That sounds like a win, right? And it is for some. But these same compounds also interact with a liver enzyme called C5p3A4, which is responsible for metabolizing many medications, especially blood pressure drugs, statins, and blood thinners. Now here's where the risk becomes very real. When pomegranate inhibits that enzyme, it can slow the breakdown of these drugs. That means more medication stays in your system longer than intended. And for a senior on a fixed dose of warfarin, clopidogrel, or even simvastatin, that can lead to overdosing effects without even changing your prescription. Let's consider a real-life case. An active 72-year-old woman, managing atrial fibrillation and high blood pressure, starts drinking a daily glass of pomegranate juice. She's heard it's great for her heart. Within a few weeks, she notices unexplained bruising, dizziness, and fatigue. After a fainting episode, her doctor runs blood work. Her INR, a measure of blood thinness, is dangerously high. She was unknowingly amplifying the effect of her medication by combining it with pomegranate. And this isn't just anecdotal. A study published in the American Journal of Cardiology highlighted concerns about grapefruit-like interactions from pomegranate juice. Another study in drug metabolism and disposition confirmed its inhibitory effect on C5p3A4, reinforcing the need for caution among polypharmacy patients, especially the elderly. Then there's the matter of potassium. Pomegranate is rich in it, which again sounds like a benefit, unless you're one of the many seniors with impaired kidney function. High potassium levels in the blood, called hyperkalemia, can disrupt your heart's rhythm. This can lead to palpitations, arrhythmias, or in extreme cases, cardiac arrest. If you're already taking ACE inhibitors, ARBs, or potassium-sparing diuretics, you're at an increased risk. And sadly, many seniors fall into that category. Pomegranate's blood-thinning effect also warrants caution. If you're on aspirin, warfarin, or newer anticoagulants, like apixaban, the additive effects of pomegranate juice could increase your risk for internal bleeding. Bleeding that might not be obvious until it becomes an emergency. This is especially problematic because the signs are so subtle at first: fatigue, a little dizziness, bruises that take too long to heal, easy to ignore, easy to misattribute to aging. And by the time someone connects the dots, the damage may have already begun. So what's the takeaway here? First, if you're on heart medications, blood thinners, or cholesterol drugs, speak with your healthcare provider before consuming pomegranate regularly, especially in concentrated juice or supplement form. Second, avoid large amounts of pomegranate juice if you're managing kidney disease or on potassium-regulating medications. Even though it seems natural, the potassium load is substantial enough to matter. Third, moderation is everything. A few fresh arils sprinkled on a salad or mixed into yogurt can be a healthy addition, but downing full glasses of concentrated juice daily can push you into dangerous territory. Finally, always check with your doctor or pharmacist about potential fruit-drug interactions. We often think of prescriptions as the only variables, but food, especially strong fruits like pomegranate, can dramatically alter your body's chemistry. The bottom line, pomegranate has incredible benefits, yes. But for seniors with complex medication routines, it's a fruit that requires respect. Because what helps one system may disrupt another. It's important to remember that superfruit is a marketing term, not a medical one. And even the most praised natural remedies come with trade-offs that matter more as we age. So far, we've peeled back the layers on mango, dried fruits, grapefruit, pineapple, papaya, lychee, and now pomegranate, each one with its own hidden challenges for aging bodies. This doesn't mean these foods are unsafe, but moderation is key. And it's vital to inform your doctor about your regular diet, especially if it includes high salicylate foods or supplements. Think these fruit were risky? Wait until you hear what's coming next. It's something almost every household has, and it might be silently harming your brain. Subscribe and comment below what you think it is. Don't miss what's next with your valuable suggestions.